Chest pain is experienced by all of us at least once in a while. The reasons for chest pain, it varies. Not all left-sided chest pain is a heart attack, and sometimes even pain on your right shoulder, it can be heart attack. So let us know the common causes of the chest pain. I will just explain the common causes very briefly, and later in my later videos, I will try to explain each of the topic in detail. So let us begin. The first one being anginal pain. So what is your anginal pain? In this kind of pain, there is a deep crushing, stabbing type of pain in the middle of the chest, posterior to your sternum. The patient will get relief with rest. The pain aggravates with strenuous exercises or exertion. Yes, and the pain, it aggravates especially in the winter morning after a heavy meal. Pain subsides after around 20 minutes, approximately around 20 minutes. That too, it varies. But yes, approximately around 20 minutes, and the pain gets relieved with rest. So this was your anginal pain, very briefly. Next reason of your chest pain can be myocardial infarction. Myocardial infarction, commonly known as heart attack. So myocardial infarction, it also has the symptoms quite similar to anginal pain. Oh, I just forgot to mention, anginal pain, it can radiate to your left shoulder commonly and less commonly to your right shoulder, sometimes trunk, epigastrium, neck, and also to the chin. So these symptoms is quite same in myocardial infarction also. Only difference being myocardial infarction pain, the pain of a heart attack, lasts more than 20 minutes, and there is also associated sweating, hypotension, anxiety. Clinical findings also include cyanosis. There is a lot of panic, and the pain is more intense than anginal pain. Also, in myocardial infarction, the pain doesn't subside even with the rest. And your next cause of chest pain, it can be because of pneumothorax. What happens in pneumothorax, what kind of pain you get is, there is pain after strenuous exercises, after exertion, and pain during cough. There is distended neck veins, tachypnea and tachycardia. There is also decrease in the chest mobility. Another reason for your chest pain can be pleurisy. Now, what happens in pleurisy, what kind of pain you get is, there is a sharp tearing type of pain. It can be caused due to inflammation, infection, neoplastic infiltration, or trauma. Now, this pain is very much localized, especially in the axilla or beneath the breast. Another reason again can be mitral valve prolapse. Now, mitral valve prolapse, it is diagnosed with echocardiogram. There is a history of non-specific kind of chest pain, and the physical findings, it includes mid-systolic click and late systolic murmur. Yeah. So echocardiogram, it confirms the diagnosis of mitral valve prolapse. Then comes your pericarditis. Pericarditis, the pain is located retrosternally in the middle of the chest, again retrosternally behind your sternum, and there is a deep crushing type of pain again. Pain increases with deep breathing and with the rotation of the trunk. Means with the change of the posture also of the trunk, not of your hands or legs obviously. When there is rotation of the trunk, the pain of pericarditis, it aggravates. Also, the pain aggravates in lying position and is relieved by standing up or sitting and leaning forward position. So this is the kind of pain experienced when a person is having pericarditis. Okay, moving on to next. Next is your dissecting aneurysm of aorta. Now this is commonly seen in hypertensive male. What happens in this kind of chest pain is, this pain, it is again on the middle of the chest, but it radiates onto the back. And also this if the patient is having this dissecting aneurysm of aorta, there is asymmetry in the brachial, carotid, and femoral arteries. Paresis can occur if there is involvement of spinal artery and carotid arteries. So the person has to be very careful, and the treatment needs to be started very soon when there is dissecting aneurysm of aorta. Moving on to next, one of the commonest cause of chest pain, which we always relate it with heart attack, or we say that I am having heart pain, but that is all your reflux esophagitis because of the heavy intake of meal, no exercise, sleeping just after the meal, having a lot of junk food. It leads to esophagitis, where you feel burning type of sensation all around your chest, at times localized into the left side of the chest, where you get anxiety, that you feel that, oh my god, I may be having chest pain, means this is my heart attack, but it is not at all heart attack. It can be because of reflux esophagitis, where you feel like a burning sensation in your chest. Also pain sometimes just radiates, the pain radiates up to the throat. And yes, there is regurgitation of gastric contents into the mouth. There is also too much of bloating of your stomach also. So this can be differentiated, that if you have had a heavy unhealthy meal, and then you started to get this heartburn or heart pain type of thing, and then you have a regurgitation of gastric contents into your mouth. So yes, this kind of chest pain is caused by your reflux esophagitis. Next, the common cause, yes, one of the very commonest cause of chest pain can be musculoskeletal pain. Now, musculoskeletal pain, this is one of the very vast topic. As told earlier, I'll cover each of the topic very in a detailed manner in my later videos. So musculoskeletal pain, the pain of your chest, it can be because of the fracture of the ribs, some problems in the intercostal muscles, because of your wrong breathing patterns, and also costochondritis, and many more reasons. Now, musculoskeletal is a very, very vast topic. I'll cover that later. Okay, so what can be the next reason of chest pain? Let me think first. Fine, yes. Also, some of the gastric conditions can also lead to chest pain. Some of the abdominal conditions like acute pancreatitis, acute cholecystitis, perforated ulcer, all these can also mimic your chest pain. So we have to be very careful in what we eat, what we drink, when do we sleep, how much we exercise, as all the minute things is also related with the chest pain. And yes, now I think I've covered all, at least the basic causes. Yes, one more thing. It can be because, yes, you can get chest pain because of esophageal spasm also. Now, this type of chest pain, it mimics with the anginal pain. But the only difference is that the patient gets relieved after the intake of nitrates and after the rest. So, yes, all the chest pain, it seems like, yes, I'm having heart attack, I'm having chest pain, I'm going to die, this is my anxiety, I'm having panic attack, but chest pain differs. It is not that all your left-sided chest pain is a heart attack also, but that doesn't mean that you should neglect any type of chest pain. So yes, as told earlier, I will be talking about all these heart attack, anginal pain, pericarditis, everything in details in my later videos. So these were just the basic common causes of the chest pain. So if you are interested to know about all these clearly, stay updated, do subscribe to my channel if you haven't yet. And yes, press the bell icon to never miss an update. See you later. Bye-bye.